we focus on the early detection and prevention of health risks based on mathematical and medical models. Recognizing the critical importance of cross-disciplinary studies, the University of Tokyo has established a variety of medium-term research coalitions. For example, the Research Institute of Biomedical Science and Engineering has been pursuing interdisciplinary research between medicine and engineering. Modern medicine consumes large amounts of electricity and water. In addition, it generates large amounts of waste products. One way to reduce medical waste is to stop using disposable kits and disinfect and reuse the same syringes and needles. However, physicians will not accept this idea because it will increase the risks of disease transmission. Green medicine contributes to eco-friendly and sustainable healthcare. Telemedicine has the potential to make medical practice more eco-friendly. Telemedicine offers various advantages. The use of telemedicine can be cost-effective and even eco-friendly because it reduces clinic visits, travel time, and unscheduled care. There are a number of barriers to telemedicine, including limited availability of patient clinical data. Information other than audiovisual data is not readily available in a home setting. Technological innovations help overcome these data gap issues. In a face-to-face consultation, the physician checks eye conjunctiva to detect anemia. A deep learning-based system has been developed to quickly and accurately predict anemia from images of the conjunctiva. We are currently engaged in a research and development program aimed at developing innovative telemedicine platforms. Telemedicine requires the collaboration between experts in the medical, biological, physical, pharmaceutical, engineering, and other sciences. I'm going to lead further interdisciplinary projects and contribute to innovative telemedicine.